Well, home health in general really is special because of the fact that you really get to know your patients. You're very involved with them, get to know their stories, and uh, can kind of bring a unique perspective to it and get them help in a different manner because a lot of times when you meet them in the office, they're not necessarily going to tell you the whole truth, but when you go into their house, you can see have they not eaten in 3 days, if not, then they need help with that. Um, so I think from the home health aspect, that's what I really like. Okay. Your lung sounds are clear, no crackles or gurgles. They sound really good.
Home health has basically been my life. I grew up in a healthcare background. My mom is a nurse and my dad is a respiratory therapist. So they have had their business since 1995. I've seen the business side, I've seen the clinical side. So it's just something, it's been part of my life.
An average session really depends on what the patient needs as far as a wellness exam is vitals, listening to the chest, belly, lungs, checking the patient's feet, and just talking to them, making sure everything's okay.
I can't see it.
Right, it's kind of
So-
awkward. No, it looks excellent, much better than it did before.
Mhm.
So it looks like it's healed up really nicely.
It just depends on the patient because everyone is different. But I initially check vitals, kind of see where they're at for the day, and just work on the goals that I can.
Yeah, there you go. There you go.
Well, I don't like that idea either.
Well, that's going to be the best way to do it.
So a lot of it has to do with upper extremity strengthening, range of motion, depending on what the patient is able to do at the time. A lot of balancing, seated balance, standing balance as well. It just varies.
Well, thank you for doing this. I really appreciate it.
Okay.
Yeah.
I personally feel like I was called to serve people. I enjoy just making an impact on people's lives, and I feel like being an OT, I get to do that every day.
9, one more, 10.
The thing I like the most about my job are my patients. We just have the best patients. They're so sweet. Go ahead and pull me towards you. Excellent. Now push me away. Good. They're amazing and they make the job worthwhile.
If I could just do that in the flower beds down below, I'd be great.
I don't know, the weeds wouldn't stand a chance. You've got a good grip. It's very rare that we have somebody that's unhappy, and I think it speaks to the quality of our clinicians that most of our patients are really happy with the care they receive and really happy to see us.
Well, I recently had a patient where they were post-stroke and they were brought out by their son, and he had to literally carry him into the living room and set him down. 3 weeks later, he was able to walk out on his own, shake my hand, and say thank you with a big smile. Things like that are what really make this job rewarding, but just in general, you're getting to help others.
Okay. Knees apart, working on the hip flexors.
You have all of these skill sets coming into one setting, working with one patient, and it's just fun to watch as a team helps one person reach their goals. What Harvard Partners does really well is they know your skill set, they know what you can bring to the table, and they allow you to do your job.
Everybody's really working hard to take care of the patients. Everybody's very passionate about what they do. The clinicians are excellent, and I hear from the patients all the time how much they enjoy their clinicians, not just from a physical therapy or occupational therapy standpoint, but just enjoy them as people coming to visit them.
Gene's a nature guy. Very in touch.
Okay, skin get really tight, but just for a minute, I'll let it up as soon as I can.
I've had the opportunity to work with some of the other physical therapists. I've met some of the other nurses, and it doesn't feel like I'm just working by myself. I feel like I can look to talking with the physical therapists or the occupational therapists. There's a sense of community.
They are confident that you can go and see your patients, and they back you 100%. They give you the resources. They have a support team a scheduling team that helps you with managing your time so you can focus on the patient at the end of the day.